Moving on, the inflammatory processes begins when your body detects harmful stimuli, such as pathogens, damaged cells, or toxic compounds. In response, a series of biochemical reactions occur that cause redness, warmth, swelling, and pain, which are the classical signs of inflammation. Key players in this defense mechanism include the immune cells, which are neutrophils, macrophages, and lymphocytes, which are first responders that eliminate invaders and clean up debris. Then we've got blood vessels. The blood vessels dilate to increase blood flow to the affected area, helping to deliver more immune cells and nutrients. Now, chemical signals occur via cytokines, prostaglandins, and histamines, which are released to amplify the response and signal other cells to join in the defense. The ultimate goal is to resolve the damage, remove the threat, and restore normal function. However, when this mechanism is overactive or misdirected, it can lead to tissue damage instead of repair. Now, inflammation can be categorized into two types, acute and chronic, each serving distinct roles in the body. Acute inflammation is a short term response, usually lasting from a few hours to a few days. It is triggered by injury or infection, and its primary purpose is to eliminate the cause of the damage and promote healing. For example, if you sprain your ankle or catch a cold, acute inflammation helps you recover by increasing blood flow, mobilizing immune cells, and removing harmful agents. The classic signs of acute inflammation: redness, heat, swelling, pain, and sometimes loss of function, which remains the fifth sign of inflammation. Unlike acute inflammation, chronic inflammation is a slow, long term response that may last for months or even years. It occurs when the body continues to send inflammatory signals even when there is no immediate threat or the initial issue has not been fully resolved. Chronic inflammation is often subtle and can go unnoticed for long periods. This persistent state of inflammation can damage tissues and contribute to a wide range of diseases, including heart diseases, diabetes, arthritis, and even cancer. Now, in summary, while acute inflammation is a helpful and necessary response to short term harm, chronic inflammation is like a low grade fire that slowly damages the body's tissues, leading to long term health problems. Now, inflammation is a highly coordinated biological response that involves various cells, signaling molecules and processes that work together to protect the body. Understanding the intricate physiology of inflammation gives us insight into how the body manages injuries and infections, and what happens when this process becomes dysregulated. Now, when the body detects harmful stimuli, for example, you got pathogens like bacteria, viruses, fungi, you got toxins or physical damage, it triggers a complex cascade of events. The cells in the affected area release signals that alert the immune system to mobilize its defense forces. These signals attract immune cells to the site of injury or infection, where they work to neutralize the threat and initiate the healing process. Now, once the threat is eliminated, anti inflammatory signals are released to resolve the inflammation and begin tissue repair. Now, acute inflammation can be triggered by various types of injuries or exposures, each activating the immune system in a rapid but controlled manner. The first being infections. When the body is invaded by pathogens such as bacteria, viruses, or fungi, acute inflammation is the first line of defense. For instance, a sore throat caused by Streptococcus bacteria triggers acute inflammation, leading to swelling and pain as immune cells rush to the site of infection to fight the invaders. Physical injuries, such as a sprained ankle or a strained muscle, cause damage to soft tissues. In response, the immune system initiates acute inflammation to clear away damaged cells and begin the healing process. The area becomes swollen and tender as the body works to repair the injury. Acute inflammation is also triggered by allergic reactions to substances like pollen, insect stings, or food allergens. When the immune system identifies an allergen, it releases histamines causing immediate symptoms such as swelling, itching, and redness. This type of inflammation is usually short lived, resolving once the allergen is removed. Now, each of these examples, it showcases how acute inflammation plays a role in either defending the body against pathogens or initiating the repair of physical injuries. The classic signs of acute inflammation, often referred to as the cardinal signs, are easy to recognize and result from the body's physiological response to injury or infection. These signs are essential to understand how inflammation works at the affected site. The first being redness. Redness occurs due to the dilation of small blood vessels near the site of the injury. The increased blood flow, known as hyperemia, brings immune cells and nutrients to the affected area to aid in the healing process. Next, we've got swelling. Swelling is caused by the accumulation of fluid, known as exudate, that leaks out of the blood vessels into the surrounding tissue. This happens as blood vessels become more permeable, allowing inflammation, allowing immune cells to exit the bloodstream and access the injured or affected area. Third is heat. The warmth that you feel at an inflamed site is due to increased blood flow and metabolic activity in the tissues. The inflamed area often feels warmer than other parts of the body as immune cells become active and energy intensive processes like phagocytosis takes place. Next is pain. Pain during inflammation arises from several mechanisms. The swelling puts pressure on surrounding nerves, and inflammatory mediators like prostaglandins and bradykinin sensitize nerve endings, leading to discomfort. This pain serves as a protective mechanism, limiting movement and further injury to the affected area. The fifth is loss of function. In some cases, inflammation can lead to a temporary loss of function in the affected area. For example, a severely swollen and painful joint may become difficult to move, preventing further damage and allowing the tissues to heal. Now, these symptoms are part of the body's efforts to contain the damage, eliminate harmful elements, and start the repair process. Acute inflammation is a carefully regulated process that progresses through several stages to ensure healing and resolution. The first step is the recognition of danger signals by immune cells like macrophages and dendritic cells. These cells release pro inflammatory cytokines such as IL-1 and TNF alpha and chemokines, which recruit other immune cells, particularly neutrophils, to the site of injury. Next, the local blood vessels, they widen up, they open up, which is known as vasodilation, and they become more permeable, allowing immune cells, nutrients, and proteins to move from the bloodstream into the tissues. This leads to the visible swelling and redness associated with acute inflammation. Neutrophils are the first responders to the site of inflammation. They engulf pathogens and debris in a process called phagocytosis, helping to clear the area of harmful substances. Macrophages arrive later to continue clearing the debris and facilitate tissue repair. Now, as the infection is controlled or the injury is cleared, the immune response begins to resolve. Fibroblasts are activated to produce collagen, which helps rebuild the extracellular matrix, and the new blood vessels form to supply oxygen and nutrients to the healing tissue. This phase is crucial for restoring normal tissue structure and function. In a healthy response, acute inflammation resolves once the threat has been eliminated. Anti-inflammatory signals such as the release of cytokines like IL-10 shift the immune response from a pro-inflammatory to an anti-inflammatory state. Immune cells begin to exit the site of inflammation through a process called apoptosis, and the tissue returns to its normal state. Now, once the inflammation resolves, the tissue undergoes a final phase of regeneration or scar formation. In cases where damage is minimal, the tissue may return to its original state, a process known as complete resolution. However, if damage is extensive, fibrosis or scar tissue may form, leaving a permanent change in the tissue structure. Now, chronic inflammation differs significantly from its acute counterpart. Instead of resolving after a short period, chronic inflammation persists, sometimes even for months or even years. This long term, low grade inflammation can be damaging, contributing to a range of diseases that can severely impact overall health. Unlike acute inflammation, which is an immediate and visible response, chronic inflammation is often more insidious, operating silently in the background and quietly disrupting body systems. Chronic inflammation is associated with a variety of diseases that affect different parts of the body. Many of these conditions are non communicable and are characterized by prolonged inflammatory responses that can progressively damage tissues and organs. In diseases like rheumatoid arthritis, chronic inflammation attacks the joints. The immune system mistakenly targets joint linings, leading to pain, swelling, and eventually joint deformities. Over time, the cartilage in the joints is destroyed, causing significant disability if left untreated. Chronic inflammation of the airways is a key feature of asthma. The inflammation causes the airways to become hyper-responsive, narrowing in responses to triggers like allergens or cold air. This results in wheezing, shortness of breath, and coughing. Without proper management, chronic inflammation and asthma can lead to long-term lung damage. Conditions like Crohn's disease and ulcerative colitis involve chronic inflammation of the gastrointestinal tract. This persistent inflammation leads to symptoms like abdominal pain, diarrhea, weight loss, and fatigue. Over time, the inflammation can damage the bowel, increasing the risk of complications like bowel obstruction or colorectal cancer. Chronic inflammation plays a major role in the development of atherosclerosis, a condition where plaque builds up inside the arteries. Inflammation contributes to the formation and rupture of these plaques, which can lead to heart attacks or strokes. Elevated markers of inflammation, such as C reactive protein or CRP, are often used to assess the risk of cardiovascular diseases. Chronic inflammation has been linked to insulin resistance, which is a key feature of type 2 diabetes. Inflammation in fat tissues caused by obesity and other factors disrupts the way insulin signals are processed, leading to high blood sugar levels. Over time, this contributes to the development of full blown diabetes and its associated complications. Persistent inflammation can also increase the risk of certain cancers. For example, chronic inflammation in the colon due to inflammatory bowel disease can elevate the risk of colorectal cancer. Inflammation causes DNA damage, promotes tumor growth, and fosters an environment that helps cancer cells thrive. Now, these examples they highlight how chronic inflammation is not just a localized problem, but can lead to systemic, life-altering diseases.